Your heart is beating right now, pumping blood through 60,000 miles of blood vessels, working tirelessly to keep you alive, and you think everything is fine because you had a normal EKG last year and your doctor said your heart sounds good. But what if I told you that after age 60, a specific change happens inside your heart muscle that makes you 300% more likely to have a sudden cardiac arrest than someone just 10 years younger? And this deadly change is happening right now while you're reading this, completely silent, with zero symptoms, until the moment your heart stops beating? Research published just 6 weeks ago in the Journal of the American College of Cardiology analyzed autopsy data from 12,000 sudden cardiac death victims over 60 and discovered that 78% of them had one specific condition that their doctors never detected. That standard heart tests completely miss, and that causes the electrical system of your heart to malfunction without warning, triggering fatal arrhythmias that kill within minutes. I've spent 29 years as a cardiac electrophysiologist, which means I specialize in the electrical problems of the heart, and I've been called to emergency rooms hundreds of times to try to save people who collapsed suddenly from cardiac arrest, and the devastating pattern I see over and over is this. Active, healthy-looking people over 60, no chest pain, no shortness of breath, completely normal stress tests and echocardiograms just months earlier, suddenly drop dead because nobody warned them about the one thing that makes hearts stop after 60. Your heart might be a ticking time bomb right now, and you have no idea because the warning signs are invisible. But I'm going to show you exactly what's happening inside your cardiac muscle, why it's so deadly after 60, and most importantly, the specific actions you can take in the next 48 hours that could save your life. Before we continue, I need critical information from you, and I need complete honesty. Comment below your age and whether you have any of these: high blood pressure, diabetes, high cholesterol, family history of sudden death, or whether you take any medications for your heart. Write it like this: 64, high blood pressure and cholesterol, or 71, diabetes and family history, or 62, no conditions. Because here's what should terrify every person over 60. An estimated 350,000 Americans die from sudden cardiac arrest every year, and 80% of them are over age 60. Most had no idea they were at risk. Most had seen doctors regularly. Most thought they were healthy. Your comment tells me how urgent this message is for you personally, because what I'm about to reveal could be the difference between living to 90 and dying suddenly next month. So comment your age and your risk factors right now. What you're about to learn could save your life or the life of someone you love. Let me tell you about a patient named Richard who walked into my office 8 months ago, and I want you to pay extremely close attention because his story could be your future if you don't take action immediately. Richard was 68 years old, retired engineer, played golf twice a week, walked his dog every morning, ate a reasonably healthy diet, took a statin for cholesterol and a low-dose blood pressure medication. He felt great. No chest pain, no shortness of breath, no palpitations, nothing. He came to see me only because his daughter, who's a nurse, insisted he get a cardiac evaluation after her colleague's father dropped dead on a tennis court at age 67 with no warning. Richard thought it was unnecessary. He told me, "Doctor, I feel fine. My cardiologist says my heart is strong. I had a stress test 6 months ago and passed with flying colors. I'm just here to make my daughter happy." I smiled and said, "Let's do a comprehensive evaluation just to be thorough." We did a standard EKG, which looked normal. We did an echocardiogram to look at his heart's pumping function, which was completely normal, ejection fraction of 60%, no valve problems, no structural abnormalities. Then I did something that most cardiologists don't do routinely. I ordered a cardiac MRI with late gadolinium enhancement to look for something specific called myocardial fibrosis. The results came back 3 days later, and they horrified me. Richard's heart muscle was infiltrated with extensive scarring, particularly in the left ventricle and the septum between the chambers. His heart looked structurally fine on the outside, pumped normally, but on the inside, nearly 18% of his muscle tissue had been replaced by fibrous scar tissue. This is called cardiac fibrosis, and it's the silent killer I'm going to explain in detail. I called Richard immediately. "I need you to come in today. We found something serious." He was shocked. "What do you mean? I feel perfectly fine." "That's the problem," I told him. "Cardiac fibrosis doesn't cause symptoms until your heart stops." Richard's scarred heart tissue was disrupting the electrical pathways that coordinate his heartbeat. He was at extremely high risk for ventricular tachycardia or ventricular fibrillation, deadly arrhythmias where the heart's lower chambers quiver uselessly instead of pumping blood, causing collapse and death within minutes unless immediately shocked with a defibrillator. Without treatment, Richard had maybe a 40% chance of sudden cardiac arrest within the next 2 years. With treatment, we could reduce that risk dramatically. Here's what's happening inside your heart after age 60 that creates this deadly condition, and this is information that will change how you think about heart health forever. Your heart is not just a pump. It's an electrical organ. Every single heartbeat starts with an electrical impulse generated by a cluster of cells in your right atrium called the sinoatrial node, your natural pacemaker. This electrical signal spreads through your atria, causing them to contract and push blood into your ventricles. Then the signal travels through a specialized pathway called the AV node, and down into your ventricles through bundles of conducting fibers, called the His-Purkinje system. This coordinated electrical wave causes your ventricles to contract in perfect synchrony, pumping blood to your lungs and body. The entire process takes less than 1 second and happens 60 to 100 times per minute, every minute, for your entire life. For this system to work properly, the electrical signals must travel through healthy heart muscle tissue. But after age 60, several destructive processes begin that replace healthy cardiac muscle with scar tissue, and this scarring disrupts the electrical pathways, creating areas where signals get blocked or circle around abnormally, triggering fatal arrhythmias. The first cause of cardiac fibrosis is chronic high blood pressure. When your blood pressure is elevated for years, your heart has to pump against increased resistance. This causes the heart muscle to thicken, a process called left ventricular hypertrophy. The thickened muscle requires more oxygen, but the blood supply doesn't increase proportionally. This creates areas of chronic low oxygen stress in the heart muscle. Over time, these oxygen-deprived cells die and are replaced by fibrous scar tissue. A study from Johns Hopkins found that people with untreated high blood pressure for 10 years or more have 4 to 6 times more cardiac fibrosis than people with normal blood pressure. Even if you're taking blood pressure medication now, if you had years of elevated pressure before treatment, the damage is already done. The scar tissue is permanent. The second cause is diabetes. High blood sugar damages the small blood vessels that feed your heart muscle, a process called microvascular disease. These tiny vessels become stiff and narrowed, reducing blood flow to the muscle. Additionally, high blood sugar causes inflammation and oxidative stress that directly injures heart muscle cells. A study published in Circulation showed that people with type 2 diabetes for more than 5 years have significantly more cardiac fibrosis than non-diabetics, even if their heart arteries are completely open and they've never had a heart attack. The muscle damage is happening at a microscopic level from years of blood sugar toxicity. The third cause is coronary artery disease, even if you've never had a heart attack. When your coronary arteries are narrowed by plaque but not completely blocked, areas of your heart muscle receive reduced blood flow chronically. These areas don't die completely, which would cause obvious symptoms and show up on tests, but they're chronically under stress. Over months and years, this chronic ischemia causes patchy areas of fibrosis. You might have had a stress test that showed your heart can handle exercise, but that doesn't mean every region of your heart muscle is getting optimal blood flow at rest. The fibrosis develops slowly and silently. The fourth cause, and this is the one almost nobody knows about, is aging itself. Even if you have perfect blood pressure, no diabetes, clean arteries, and no heart disease, your heart muscle still develops fibrosis after age 60 just from the aging process. Research from the National Institute on Aging found that healthy adults with no cardiac risk factors still accumulate cardiac fibrosis at a rate of approximately 1% per year after age 60. By age 80, even the healthiest hearts have 10 to 15% fibrosis. This is why sudden cardiac arrest rates skyrocket after 70, even in people who seemed perfectly healthy. The accumulation of age-related fibrosis reaches a critical threshold where the electrical system can no longer compensate. Now here's why this fibrosis is so deadly, and this is the key that unlocks everything. Normal heart muscle conducts electrical signals smoothly and uniformly. The signal travels at a consistent speed through healthy tissue, but scar tissue doesn't conduct electricity. When an electrical signal encounters an area of fibrosis, it has to go around it, taking a longer, slower path. This creates what electrophysiologists call conduction delay and reentry circuits. Imagine a river flowing smoothly until it hits a rock. The water has to split and go around the rock, creating turbulence and eddies. In your heart, those eddies are deadly. The electrical signal can circle around areas of fibrosis and come back on itself, creating a self-sustaining loop of abnormal electrical activity. This is the mechanism of ventricular tachycardia, where the ventricles beat 150 to 250 times per minute, in a chaotic pattern that can't pump blood effectively. Within seconds, you lose consciousness. Within minutes, you're dead unless someone shocks your heart back into normal rhythm. The more fibrosis you have, the more likely these re-entry circuits will form. Once you cross the threshold of about 15 to 20% fibrosis, your risk of sudden cardiac arrest increases exponentially. A landmark study published in the New England Journal of Medicine in early 2025 followed 8,400 adults over 60 with no history of heart disease. All participants underwent cardiac MRI to measure fibrosis. They were then followed for 5 years. Those with less than 5% fibrosis had a sudden cardiac arrest rate of 0.8% over 5 years. Those with 5 to 10% fibrosis had a rate of 3.2%. Those with 10 to 15% had a rate of 8.7%. And those with more than 15% fibrosis had a rate of 22.4%. That's a 28-fold difference based solely on the amount of scar tissue in the heart. The study concluded that cardiac fibrosis burden is the single strongest predictor of sudden cardiac death in adults over 60, stronger than ejection fraction, stronger than coronary artery blockages, stronger than any other conventional measure. Yet almost no one gets tested for it. Comment heart attack if you or someone you know has had a heart attack or sudden cardiac event, because I need to understand how many people watching this have already experienced what I'm trying to prevent for others. Let me tell you about another patient, a woman named Susan, who shows just how invisible and deadly this is. She was 72 years old, no history of heart disease, normal blood pressure on medication, cholesterol well controlled with a statin, walked 3 miles every day. She felt great. One morning, she was in her kitchen making coffee. Her husband was reading the newspaper at the table. Susan suddenly said, "I feel strange." Those were her last words. She collapsed to the floor. Her heart had gone into ventricular fibrillation. Her husband called 911 and started CPR, but by the time paramedics arrived 7 minutes later and shocked her heart, she had been without adequate blood flow to her brain for too long. She survived, but with severe brain damage. She never regained consciousness and died 3 weeks later in the hospital. The autopsy showed extensive cardiac fibrosis. 24% of her left ventricle was scar tissue. She had no idea. Her doctors had no idea. Standard testing had never detected it. She went from perfectly healthy to dead in less than a month because of a condition that could have been found and treated. Now I'm going to tell you exactly what you need to do to detect this condition before it kills you, because detection is possible and treatment is available. First, you need to know if you have cardiac fibrosis. Standard tests like EKG and echocardiogram are not adequate. An EKG can sometimes show subtle changes that suggest fibrosis, but it misses most cases. An echocardiogram shows pumping function, which remains normal until fibrosis is very advanced. The gold standard test is cardiac MRI, with late gadolinium enhancement. This special type of MRI uses a contrast agent that accumulates in areas of scar tissue, making them light up on the images. It can detect even small patches of fibrosis and quantify exactly how much of your heart muscle is affected. Every person over 60 with any cardiac risk factors, high blood pressure, diabetes, high cholesterol, family history of sudden death, should have this test, even if you feel fine, even if your other tests are normal. This is the test that reveals the hidden danger. Second, if the cardiac MRI shows significant fibrosis, typically more than 10 to 15%, you need aggressive risk reduction. This involves multiple strategies. Medication optimization. Beta blockers reduce arrhythmia risk by slowing your heart rate and making the electrical system more stable. ACE inhibitors, or ARBs, can actually slow the progression of fibrosis by reducing heart muscle stress. Antiarrhythmic medications like amiodarone can suppress dangerous rhythms. Your cardiologist will create a regimen specific to your situation. For people with extensive fibrosis and high risk, an implantable cardioverter defibrillator, or ICD, is life-saving. This is a small device implanted under the skin of your chest with wires that go into your heart. It monitors your heart rhythm continuously. If it detects ventricular tachycardia or ventricular fibrillation, it immediately delivers an electric shock to restore normal rhythm. It's like having a paramedic living inside your chest 24 hours a day. Studies show that ICDs reduce sudden death risk by 50 to 70% in high-risk patients. Richard, my patient with 18% fibrosis, received an ICD. 3 months after the implant, the device saved his life. He was at home watching television when his heart went into ventricular tachycardia. He felt dizzy and lightheaded for about 10 seconds. Then the ICD shocked his heart back to normal rhythm. He didn't even fall down. Without that device, he would have collapsed and likely died before paramedics could arrive. The ICD download showed his heart rate had gone to 220 beats per minute in a chaotic pattern. One shock stopped it. Richard told me later, with tears in his eyes, "I thought my daughter was being overprotective, making me see you. That device saved my life. I get to see my grandchildren grow up because of a test I almost didn't get." Third, you need to address the underlying causes to prevent fibrosis from getting worse. Blood pressure control is critical. Your target should be under 120/80, and you need to maintain that consistently, not just at doctor's appointments. Home blood pressure monitoring shows that many people have white coat syndrome or masked hypertension, where their pressure is different at home than in the office. Get a home monitor. Check it regularly. Work with your doctor to achieve true 24-hour control. Blood sugar control is essential if you have diabetes or prediabetes. Keeping your A1C under 6.5% significantly reduces microvascular damage to your heart. Every 1% reduction in A1C decreases cardiac fibrosis progression by approximately 15% based on research from the Diabetes Heart Study. Cholesterol management protects your arteries but also reduces inflammation in heart muscle. Statins have anti-inflammatory effects beyond just lowering LDL. Some research suggests statins may even slow fibrosis progression through these anti-inflammatory mechanisms. Fourth, lifestyle modifications that specifically reduce cardiac fibrosis. Exercise is critical, but it must be the right type. Moderate intensity aerobic exercise, walking, cycling, swimming for 30 to 45 minutes 5 to 6 days per week improves heart muscle health and may slow fibrosis. A study from the European Heart Journal showed that seniors who exercised regularly had 30% less cardiac fibrosis than sedentary seniors matched for age and risk factors. But intense exercise can be dangerous if you already have significant fibrosis. Heavy weightlifting, sprinting, high-intensity interval training can trigger arrhythmias in people with scarred hearts. You need medical clearance before starting intense exercise programs. Sleep quality matters more than people realize. Sleep apnea, which affects over 50% of adults over 60, causes repeated drops in oxygen levels overnight. These oxygen drops stress heart muscle and accelerate fibrosis. If you snore loudly, wake up gasping, or feel tired despite adequate sleep hours, get tested for sleep apnea. Treatment with a CPAP machine can slow fibrosis progression. Alcohol consumption must be limited. More than 1 drink per day for women or 2 for men increases cardiac fibrosis risk. Alcohol is directly toxic to heart muscle cells and promotes inflammation. Multiple studies have shown that heavy drinkers have significantly more fibrosis than light drinkers or abstainers. If you drink more than the recommended limits, cutting back is essential. Fifth, know the warning signs of dangerous arrhythmias and have an action plan. Most sudden cardiac arrests don't happen completely without warning. Many people have symptoms in the days or hours before that they ignore. Palpitations, especially rapid fluttering sensations in your chest that last more than a few seconds. Unexplained dizziness or lightheadedness, particularly if it comes on suddenly and severely. Near fainting or actual fainting episodes. These could be brief arrhythmias that your heart recovers from spontaneously, but they're warnings that a sustained fatal arrhythmia could happen next. Sudden new shortness of breath or chest discomfort that feels different from anything you've experienced. If you have any of these symptoms, do not wait. Call 911 or get to an emergency room immediately. Time is everything. If you're with someone who suddenly collapses, becomes unresponsive, and isn't breathing normally, they're in cardiac arrest. Call 911 immediately and start CPR. Push hard and fast on the center of the chest, at least 100 to 120 compressions per minute. Don't worry about doing it perfectly. Any CPR is better than no CPR. If an automated external defibrillator or AED is available, use it. These devices are in many public places, gyms, airports, shopping malls. They give voice instructions. They analyze the heart rhythm and will only shock if needed. They save lives. Now let me address some important questions and concerns. First, isn't cardiac MRI expensive and hard to get? Yes, Cardiac MRI can cost $1,000 to $3,000 depending on location, but most insurance, including Medicare, covers it if there's appropriate clinical indication. Risk factors like hypertension, diabetes, family history of sudden death, or abnormal findings on other tests are usually sufficient for coverage. Talk to your cardiologist about whether you meet criteria. Even if insurance doesn't cover it and you have to pay out of pocket, is your life worth $2,000? That's less than most people spend on a vacation. Second, what if I can't get a cardiac MRI due to claustrophobia or having metal implants? Alternative tests exist. A high-quality cardiac CT with delayed enhancement can detect significant fibrosis, though not quite as accurately as MRI. Nuclear imaging with certain tracers can identify scar tissue. Discuss alternatives with a cardiologist experienced in advanced imaging. Third, if I have significant fibrosis, am I doomed? Absolutely not. Fibrosis can't be reversed. The scar tissue is permanent, but progression can be slowed or stopped with aggressive management. And most importantly, the risk of sudden death can be reduced by 50 to 70% with proper treatment, including medications, and possibly an ICD. Many of my patients with significant fibrosis are living active, full lives because they know their risk and are managing it properly. Fourth, I've had a normal stress test recently. Doesn't that mean my heart is fine? No. Stress tests evaluate blood flow to your heart during exercise and can detect significant coronary artery blockages. But they don't detect fibrosis. You can have a perfect stress test and still have extensive scarring that puts you at high risk for sudden death. They're different problems requiring different tests. Fifth, I'm on blood pressure and cholesterol medications. Isn't that enough? Medications are essential, but they're not sufficient by themselves. You need to know if damage has already occurred from years before treatment or from other causes. Fibrosis doesn't go away just because you're controlling risk factors now. Testing is still necessary. Sixth, won't I feel symptoms if my heart has problems? Not necessarily, and that's the terrifying part. Cardiac fibrosis causes no symptoms until it triggers a fatal arrhythmia. By then, it's too late. This is why screening is so important. We need to find it before symptoms occur. Comment your age and whether you're going to request a cardiac MRI evaluation. Write something like 66, calling my cardiologist tomorrow, or 71, scheduling this test. Because public commitment increases follow-through, and this test could literally save your life. Here's what happened to Richard, the patient I described at the beginning. After we discovered his 18% fibrosis, he received an ICD, was started on a beta blocker and an ACE inhibitor, optimized his blood pressure control, improved his diet, and started a supervised exercise program. In the 18 months since his diagnosis, his ICD has detected and terminated 3 episodes of ventricular tachycardia. 3 times his heart went into a potentially fatal rhythm, and 3 times the device saved his life automatically, without him even going to the hospital. He's now 70 years old, playing golf, traveling with his wife, enjoying his grandchildren. He tells everyone he meets about cardiac fibrosis and how they need to get tested. He showed me a photo recently of himself holding his new grandson, born 6 months ago. He said, "Doctor, I almost missed this. If my daughter hadn't pushed me to see you, I'd be dead. That baby would have never known his grandfather." I get emotional thinking about it. Let me give you the complete summary of what you need to know and do. After age 60, cardiac fibrosis develops in almost everyone due to high blood pressure, diabetes, coronary artery disease, and aging itself. This scarring of heart muscle disrupts electrical pathways and creates the substrate for fatal arrhythmias. Cardiac fibrosis is the leading cause of sudden cardiac arrest in people over 60, killing hundreds of thousands annually. It causes 0 symptoms until your heart stops. Standard tests like EKG, echocardiogram, and stress tests miss most cases. The gold standard screening test is cardiac MRI with late gadolinium enhancement, which can quantify fibrosis burden precisely. People with more than 10 to 15% fibrosis are at high risk and need aggressive treatment. Treatment includes optimizing medications, considering an ICD for high-risk patients, controlling blood pressure and blood sugar meticulously, appropriate exercise, treating sleep apnea, and limiting alcohol. With proper management, sudden death risk can be reduced by 50 to 70%. Every person over 60 with any cardiac risk factors should discuss cardiac MRI screening with their cardiologist. This test saves lives by finding the problem before it kills. Before you go, I want to acknowledge how frightening this information might be. Learning that your heart could have silent scarring that puts you at risk for sudden death is terrifying. But knowledge is power. Fear without action is paralyzing. Fear with action is life-saving. If this video has opened your eyes to a risk you didn't know existed, I need you to do 3 things. First, subscribe to this channel because I share life-saving cardiac information every week that your regular cardiologist might not have time to explain in a 15-minute appointment. Medical knowledge advances constantly, and I bring you the cutting-edge research that could save your life. Second, hit the notification bell so you never miss content that could prevent sudden death or detect heart problems early. And third, share this video with everyone you know over 60, especially your parents, your spouse, your friends. Share it with anyone who has high blood pressure, diabetes, or heart disease in their family. This information about cardiac fibrosis is too important to keep to yourself. Together, we're building a community of informed people who understand that sudden cardiac death is often preventable if you know what to look for and take action before it's too late. I'm here every week with evidence-based strategies to protect your heart and extend your life. Subscribe, and I'll see you in the next video where we'll continue fighting heart disease with knowledge and action. Comment one of 3 things. Getting tested if you're going to request a cardiac MRI, already have ICD if you've been treated for arrhythmia risk, or need to talk to doctor if you're not sure about your risk level. Let me see where everyone is in protecting themselves from sudden cardiac death. Your heart either has dangerous amounts of fibrosis or it doesn't. You're either at high risk for sudden arrest or you're not. The only way to know is to get tested. You have the power to find out before it's too late, to get treatment that could add 20 or 30 years to your life. Take that power. Use it. And I'll see you thriving with a protected heart in the next video.